Hi, this is Dr. Narda Robinson, founder and CEO of CureCore Med and CureCore Vet. And today I want to talk to you about medical acupuncture myofascial anatomy and how to avoid the 12 common palpation errors that I see happening in some of the students, whether we see them on site or we're doing video uploads or, when I go watch other people palpate. There's just some things where we can just do a better job palpating correctly, palpating the patient entirely, and palpating because diagnosis comes first. And then when we really know what's going on, we'll be better able to nail down what are the problems and how can we fix it, what needs to happen here. So the 12 common palpation mistakes that I've identified over the past 25 years of teaching are these. We have bad personal habits, there's 3 of those, imprecise anatomy, and then 6 rookie mistakes. For bad personal habits, we don't want our nails to be too long. We want them to be cut at the top of the horizon of our fingers so that we aren't stuck palpating with just flat hand. We want to really not dig our fingers in, but really understand with, being able to move our fingers around and get in little nooks and crannies without piercing the patient's skin or bothering them. And then we don't want to talk too much. We want to think about getting a massage yourself. It's much more soothing if things are quiet and your practitioner is focusing on you, not distracted. It's such a big difference if you're busy talking versus really connecting with your patient. Ignoring and underestimating problems. Assume what you're seeing is real. Don't ascribe it to a behavioral problem until you prove yourself otherwise. Usually it's something real. And then another mistake people make is just looking for sensitive spots without really understanding what's under there and what is this clinical significance. Patient parts. This is a whole patient. It's not a cruciate walked into a doctor's office. It's the whole patient. And as such, whether or not one little piece of connective tissue is disrupted, we need to understand that in the context of all the anatomy and all the structural changes that have happened to maybe give us a problem there, or maybe it's something completely different. So we keep our minds and our hands alert. Missed diagnoses. Maybe there are places that you're accustomed to not palpating, like the medial aspect of the forelimb and all those flexors. It's not just what you see on the dorsum and on the lateral aspects. There's a whole bunch of patient inside there and between the scapulae with the rhomboids. And here's a tip if you are a medical acupuncturist, that you can really, as you're being quiet, not talking with your patient about the latest movement or the clients, about the latest movies and what you've been doing, attend to the tip of the needle and the resistances of the tissue that it's encountering. And that gives you vision inside the tissue. Like think of a dog with a really thick neck. If you palpate on the surface, oh, they didn't react. Oh, I'm not feeling anything. You're just missing. You should be expecting to find things. There's so much neck there. There's a lot of tissue in there that is tense. But if you have a needle and you can think, okay, here I am. Yes, I can feel that resistance with the tip of the needle. That's wonderful. That's such a great tool to have. So 6 rookie mistakes, going too superficial. I'm not going to find anything. Oh, no, you're fine with all that. Big mistake. You've missed everything. Too deep or painful. Even if you had teachers in school that were really hurting animals and making them scream or cry. We don't do that. That's old. That was not the right way to do it. We're not going to passively turn the neck around, make them scream. At the same time, we're not going to dig our hands in. I had a neurology professor in school, held the animal up and just squished their back in between there to see if they were painful. It was so awful. There were things in vet school I just had to leave about. And then if you are palpating along the longitudinal axis of the muscles, you're missing things. You're not going to find tension and trigger point, definition. Your animal is not going to respond to you appropriately if you're just going in between the muscles. You need to go cross fiber. You will miss things if you go longitudinal. See that over and over. I don't know which courses are teaching that, but when I see people, even rehabilitators, that are just going like this, it's like you are missing everything. Repetitive palpation, we don't just say, is that sore, is that sore, is that sore? You find it, you blend with the tissue, you do appropriate palpation, and then you move on. Trust yourself, because if you are letting your hands speak and your heart is listening, your brain is integrating, and you're using your eyes to watch them, and are they giving you information to confirm? That's where that should be, not just letting the animal tell you. And then when we go into the myofascial anatomy with medical acupuncture, we are looking for long lines. We're not just looking for spots in the muscle belly, isolated spots. We need to read the whole page. You don't just read a word at a time. You look for the whole sentence and the meaning of the sentence. Each location that you identify as tender to palpation is a word. Together, they make a sentence when you feel the long lines. And all in the whole context of the patient, you get the meaning of what their body is telling you. So where are the long lines? We have different systems that we can follow. One is the medical acupuncture channels. I'll review that real quick here. And then there are myofascial trains, which are kind of adaptations from acupuncture channels. That's from Tom Myers. And then kinetic chains from physical therapy. But really nothing pulls it all together as well as the medical acupuncture channels that have been extrapolated from the human. If you want to review where the human lines and locations are for each acupuncture point, if you're in the acupuncture course, you've probably gotten a copy of my book, Interactive Medical Acupuncture Anatomy, or you can look up lines online. But then here we have our anatomy images, and I have extrapolated them onto the non-human form. And so with the lung line, we see that is coming over the pectorals and then is coming along this flexor surface of the brachium and then the flexor surface of the forearm to the thumb in the human. And as we go through these, each two form a pair, a complementary pair. So the functionality of the lung line is that is together, all working together, and that is flexing here. And it's not like we have flexors and then extensors. It's not crazy. It makes sense from a functional perspective. If we move to the large intestine, then we have extensors coming from the index finger in the human, and then all the extensors up the antebrachium, and then the triceps to the shoulder, to the neck, and then to the, it's the only one that crosses the midline, goes to the other side. But, it's like, if we activate all of that, that's way different than the lung line. So lung, large intestine, complementary pair, and both associated with the radial nerve, and we can trace them in the human. It makes it easier. The extensor surface and the flexor surface, we just go on the distal. Then we have a whole part of this thoracic limb that is working together and in a complementary fashion. Let's look at the pelvic limb here, part of the stomach line, and don't be confused too much by the organ names of these channels. It just happened along the way. Acupuncture has a long history, and at some point there were organ names associated with what were formerly really called just by the surface of the body that they were on, because it's misleading. Because, for example, large intestine line, none of the 20 points on that large intestine line really treats the large intestine. So it's just a manner of naming. It's a little confusing, and then you get so used to it you don't even notice it. But stomach, if we talk about the stomach channel on the pelvic limb, that's in the craniolateral aspect of the pelvic limb. The spleen line, its counterpart, is on the craniomedial part of the pelvic limb, and together they help with stability, at least for this cranial aspect. We have other channels on the back of the limb, but together, there is stability, whether it's the lateral aspect of the quadriceps, the medial aspect of the quadriceps, or the crus, extensors and flexors. Back to the thoracic limb, the heart line and the small intestine line are both relating to the ulnar nerve. So heart line, small intestine line, just like lung and large intestine were with radial nerve, heart and small intestine are with ulnar nerve. So same nerve, but very different in terms of the functionality for the structures involved and collected into a line, a functional line, linearity that we can understand based on the anatomy and how it all works together. When we move, we don't say, oh, I'm going to move this muscle, this muscle, this muscle, this muscle. Our brain is already organized with, oh, I want to touch my eyebrow, or I can touch it this way. I'm going to just automatically use certain muscles. I'm not using my leg muscle to move my arm. And so it's really the outcome that the body organizes, the nervous system organizes around. Here, again, if we look at even, let's look on the back, which is bladder line, which is paraspinal, and kidney. It's paired channel, bladder line, kidney line. So if we took a knife down the middle, we could just go from bladder to kidney on the front. But what does that mean functionally? So we have upright posture, or in a human, upright and then flexed. So balance, complementarity. We can talk about agonist, antagonist. That's probably a little too simple for what the acupuncture channels help us organize. Now we're back to the thoracic limb, pericardium. Easier on the human because we have a nice flat, not pronated situation here. Pericardium goes over the median nerve here, and then triple heater, just another funny name, comes down the middle between the radius and ulna here. So again, if they're paired, pericardium, triple heater. Heart, small intestine. Lung, large intestine, except pericardium is median nerve and triple heater has branches of the radial nerve. So different nerves, but still, if the muscles along the pericardium, the myofascia along the pericardium isn't flexible, then I can't fully activate the muscles of the triple heater line because there's going to be restriction there. So when we palpate, if we find dysfunction, the channels and their pairings allow us to think, let me see what's going on the other side of that. We can continue. Gallbladder comes down the lateral aspect of the crus, and liver comes up the medial. But it's very different surfaces. Gallbladder line is really connective tissue-y, really fascia-y, gets really tight. Liver line is over lymphatics and vessels. So it's different nature of structures, but still worthwhile considering when you're palpating. And then just a couple of midline channels, governor vessel and conception vessel. And in acupuncture, we talk about the actual vascular origins and representations internally of what these external representations mean in the significance, but just everything comes together at the midline, and that is very organizing. We can palpate down the fascial midline, but then also what's going on with the top line and how do both of them and dysfunctions along there change body posture, movement capacity, health, circulation, awareness, spatial characteristics, etc. So I hope that was just, it was a whirlwind tour through things, but some key elements that if you can grasp the medical acupuncture channel anatomy, and then plus the significance of why you need to palpate in a blending fashion, in a nicely organized way, just like the acupuncture channels give us that information, rather than spots. And really your finesse, your technique is going to give you much higher quality information. So I look forward to hearing from you. You can contact us. Here's the website, curacore.org. You can email me, narda@curacore.org, or give us a call. So I look forward to hearing from you. If you're already in one of the courses, just let me know if you have any questions about this, and we'll be doing a lot of practice too.